Welcome to Hidden Headlines. We're jumping right in today, looking at this government shutdown situation. We need to unpack the report on how it got triggered, specifically by Democrats.
That's right. And the core of it seems to be this rejection of a bipartisan funding measure. They turned it down.
Yeah, they turned it down. And the reason seems pretty specific. They insisted on adding provisions, funneling billions in federal healthcare dollars. We're talking expanded Medicaid, Obamacare subsidies specifically to illegal aliens.
And that's funding, crucially, that isn't available to low-income American citizens. It's quite something.
It really is. And you can see why some are framing this as, well, a pretty reckless America last kind of agenda. The prioritization seems off.
Well, the immediate effects are hitting hard. We're already seeing it. Federal workers, they're about to miss paychecks.
Right. And the WIC program, that's Women, Infants, and Children Nutrition Assistance, that's running out of money.
And maybe the most shocking part, active duty service members, they're facing delayed pay now with everything going on globally.
The Trump administration, they're digging in. The report says they're calling it democratic extortion and refusing to give in.
Yeah, refusing to channel, over $200 billion over the next decade to non-citizens. That's the figure being discussed.
And the details are, well, there's something else. The report mentions that these provisions could actually give illegal aliens higher Medicaid reimbursement rates for emergency care than disabled or elderly American patients get.
It's hard to believe, and you have to remember the backdrop here. A $37 trillion national debt. So this shutdown, it's not just politics. It forces some really tough fiscal decisions.
Yeah.
Austerity, basically.
And the White House is placing the blame for that austerity squarely on the Democrats who voted for the shutdown.
Exactly. You stop the revenue, you have to look at the books.
You know, listening to all this, it makes you think about how important it is to have different voices, different perspectives out there, if you feel like your voice isn't being heard.
Oh, absolutely. And that's why we've been really impressed with the Next-Gen Business. They have this program called the Become a Reporter system.
It's really good. It's a 30-day thing, helps you figure out how to actually unlock your voice, find good sources, put together content that people actually want to see, and, build an audience.
Yeah, gives you a solid framework. Highly recommend checking that out.
Okay, so let's get back to the specifics from the press secretary's briefing today. 4 key things came up. First, the immediate consequences. What hits tonight if this doesn't get fixed?
Right. Story 1. It's pretty stark. 3 things happen tonight if the government stays closed. Federal workers don't get their next paycheck.
Okay.
WIC funding is completely gone, zeroed out.
Wow.
And service members miss their next paycheck. Those are the real-world costs hitting tonight.
That's incredibly serious, just unacceptable. What about the president's commitment? Where does he stand on healthcare overall in this mess?
The press secretary made it clear. The president is, quote, definitely committed to fixing and improving our healthcare system. No question there. But he's remaining very firm that the government has to be reopened first. You can't negotiate major policy like this while the government's shut down and not taking in money. It's just not feasible.
Makes sense. Speaking of getting different perspectives and maybe cooling things down a bit, we should mention the Next-Gen Business again.
Yeah, definitely. What they're doing is really valuable, trying to de-radicalize the extremes by just sharing news from all sides. You get center, left, right viewpoints. It feels like a genuine effort to, help heal the divide.
It really does. And listeners can actually get involved. They have a free Become a Reporter challenge. It's a great way to start participating in that healing, improving the conversation.
Absolutely. A really positive step people can take.
Okay, now for story 3. The press secretary apparently brought out the receipts today, fact-checking what they called Democrat lies about the funding demands. What's the absolute bottom line here?
The message was crystal clear. According to the briefing, the Democrats' current stance means, and this is a direct quote, the only way the American government can reopen is if illegal aliens can get free health care.
So that's the tipping point. Free health care for illegal aliens or the government stays shut.
So what they're saying is holding everything up, hurting American families, soldiers, everyone waiting on this.
And that leads directly into the 4th story, which sounds pretty grim, the possibility of layoffs.
Yeah, this was serious. The press secretary stated very plainly that these conversations about potential layoffs, workforce reductions, they would not be happening if Democrats hadn't voted to shut things down.
So it's a direct consequence.
A direct consequence driven by fiscal reality. Remember that number. $37 trillion in debt.
Yeah.
When the cash flow just stops because the government's closed, you have to look at the balance sheet.
Yeah.
It's painful, but it's necessary housekeeping forced by, political decisions.
It's a lot to take in. And if you value these kinds of deep dives, getting into the details of these reports, please support the show.
Yeah, definitely. Subscribe, like the show, rate Hidden Headlines wherever you're listening. It helps us keep these conversations going, improve the discourse, and hopefully work towards, a better America for the next generation.
Absolutely. Join the conversation.
So as we finish up, maybe leave you with this thought, based on everything we've discussed from the report today. We're facing a $37 trillion debt crisis.
Right.
Is it really justifiable, morally or fiscally, to block funding for things like WIC, for our military's paychecks, risking the well-being of American citizens? all to secure over $200 billion in new healthcare subsidies for non-citizens.